So thanks for the opportunity to present at the Stock Network's ASX Gems conference. My name is Andrew Shute. I'm the Chief Corporate Development Officer at EBR Systems. So my goal today is to share with you why we believe EBR is an undervalued investment opportunity, but with the foundations in place to be a high-growth medical device company. And this is probably best explained by reviewing a summary of our investment thesis. So EBR has developed a novel medical device, the world's only leadless pacemaker to treat heart failure. Now, while we participate in the cardiac rhythm management market, and that's a market that's dominated by three major players, Medtronic, Abbott, and Boston Scientific, we are not in direct competition with them. In fact, we believe we're complementary. We are focused on treating patients who fail to benefit from traditional lead-based therapy. Now, there are other leadless pacemakers in the market, but these are indicated for treating patients with bradycardia or slow heart rate. So at launch, we expect to have a large addressable market. In the US, this will be $3.6 billion, and we expect this to increase as we look to expand into other markets, including Australia, and expand our indications. Now, our pathway to market was really underpinned by the FDA's breakthrough device designation. This allowed us to have a direct, informal communication channel with the FDA during the review process. And this actually gave us the confidence to go to the market and predict the date of FDA approval. And in fact, we received this a couple of days earlier than anticipated. And the other benefit of the breakthrough device designation is it allows us to qualify for two reimbursement schemes. The first of this is NTAP, or the New Technology Add-on Payment, and this is aimed at inpatients. And the second is the TPT, or Transitory Pass-Through Payment, which is aimed at outpatients. And both of these are expected to commence in October of this year. And I think it's actually a testament to the clinical need or demand for WISE that we've already received the first implants of WISE ahead of receiving these top-up payments. Looking towards commercialization, we plan to have a disciplined approach. So during our first year of commercialization, we'll actually be considered a limited market release. So instead of going out in a scattergun type approach, we're going to have a very, very focused target list of sites that we'll be penetrating. And these will be a combination of sites that participated in our SOLVE-CRT study, and they'll be supplemented by some additional strategically important sites. The benefit of this for us is allow us to build KOL advocacy, allow us to showcase patient success stories, and build those internal referral pathways within hospitals. So our initial focus here will be on building a sustainable utilization rate. We'll initially be targeting 2 implants per site per month. And once we start to achieve that on a site-by-site basis, we'll move on to start to penetrate our phase 2 sites. And these are really high-volume sites where we already have strong engagement from our future implanters. And then we'll move into our full commercialization phase. And to achieve this, we'll be utilizing a direct sales force. We have already put in place a strong leadership team led by Eric Strandberg, our Chief Commercial Officer. He's recruited 2 area sales VPs, Mike Manassi, who will be responsible for the East Coast, Josh Illiker, the West Coast. And in turn, they've both recruited a stellar field team. And at launch, we'll expect to start with 7 or 8 sales teams, and each sales team will consist of a sales rep or a clinical or technical specialist. Now, in January, we announced we'd signed an 11-year lease on a new facility, just a mile or 2 from our existing building, and on great commercial terms, including $4 million worth of landlord finance tenant improvements. And this site has a footprint just over 3 times larger than our current facility. Now, while we've been responsible for some of the critical manufacturing processes of our system, we've traditionally relied upon contract manufacturers for the bulk of our manufacturing process. So to support scalability, we plan to bring in a lot of this, bring in-house the manufacture of additional components with the goal of resulting in increased margins and improvement in yield and quality control as well. The larger footprint will also allow us to expand our manufacturing capacity as well, taking us well beyond the terms of the lease. And finally, just to wrap up, we're well funded. We have a pro forma balance following our recent capital placement and SPP of $96.5 million or 150 million Australian dollars, which will see us into early 2027. Thanks for your attention.